Hello, friends around the world. Firstly, I want to explain why I'm recording my videos in my car, and that's because of this. That every day I spend about 2 or 3 hours in traffic, and that's heavy traffic. And always I'm thinking about recording videos for YouTube, and because I love teaching and I love to talk about what are in my mind, and I know maybe sometimes I have some grammatical mistakes, but there is no other way. This is my language, and this is my second language, and maybe sometimes I have some problems, and forget all this and just focus on the topics that I talk about them, if you like those topics. In my last video, I talked about stem cells, and I said what are different types of stem cells. And this session, I want to talk about mesenchymal stem cells. Mesenchymal stem cells are cells that has been used for many different clinical trials, many different studies, and why they have been used, because they can be transplanted allogen. I mean, the donor and the recipient of cell can be different, and the rejection rate is known, or it's reported very, very low, because they have anti-inflammatory effect on the cells or microenvironment around them, and that's why they have been used for treatment of many different diseases, and that's because of their anti-inflammatory effect. And mesenchymal stem cells, as I said, can be differentiated to different type of cells in our body, such as blood cells, for example, such as blood cells, different types of blood cells we have, or some other organs in our body. And also these cells we see have been used in treatment of inflammation in hematopoietic stem cell transplantation. And about 3 or 4 years ago, we published an article in collaboration with Tabat Madaris University, and they did it. They used hematopoietic stem cells for treatment of blood cancer patients. Also, mesenchymal stem cells were considered for these patients, and but in our research, we didn't find brilliant result to prove that these cells 100% can be used for this condition. And this controversial result is reported in different articles. Some articles say it's good for blood patients, and some says no. These cells also have been used for isolation of their exosomes. Their exosomes are so good that I've talked about them in my channel in some other videos, and I made some videos for them, and you can go and check them about exosomes. Because cell therapy has some limitations, and these limitations are not in using exosomes, and that's why exosome therapy has became one of the best methods in cell therapy. You know, when we say cell therapy, we are not just talking about transplantation of the cell, and these exosomes are can be derived from cells, and also using them can be considered as cell therapy. And and the difference between the results is so brilliant, because there are some limitations in cell therapy, like the rejection, like transdifferentiation, or some other side effects that they are not reported in using exosomes. And also exosomes have been used for different therapeutic purposes, and I will explain about them with more details in next videos. In next videos I will explain about them. And now see where I am. I'm driving, and see you in my next video.